Xung quanh chúng ta hiện tại sẽ có những người thân, những bạn bè, những người chúng ta biết vô tình mắc những căn bệnh rất là nan y, và thậm chí gần đây nên có nhiều cái tin cũng khá là buồn bởi những người bạn của mình đã phải tạm biệt cõi trần, và thậm chí có những người bạn đang mắc căn bệnh ung thư hiện tại đang nằm hóa trị, xạ trị tại bệnh viện. Đó là những cái nỗi đau mà những người ở lại đôi khi sẽ rất là cảm thấy rất là đau xót. Đó vì lý do đó Danny muốn chúng ta luôn luôn cần phải lưu tâm, để ý và cẩn thận trước những cái căn bệnh mà mình có thể bị mắc phải trong tương lai. Thì hôm nay cái chủ đề hôm nay chúng ta nói về ung thư gan, nói về ung thư gan có đáng sợ hay không, và cách chúng ta nhận diện cũng như là phòng tránh như thế nào cho nó hiệu quả. Vậy thì hôm nay chúng ta sẽ cùng nhau được lắng nghe vị bác sĩ Lee Trung Kim chia sẻ.
Good evening, everyone. In Vietnam, I'm Dr. Lee from Local Life Specialist Center here in Penang, Malaysia. So to begin with, primary liver cancer is a malignant tumor that starts in the liver. We have the main type, which is hepatocellular carcinoma, or in short we call HCC hepatoma, which arises from liver cell. A less common type will be the bile duct cancer or cholangiocarcinoma, a very rare type of cancer which arises from the blood vessels is known as angiosarcoma. These are the three main types of primary liver cancer. Secondary cancer in the liver is actually more common, probably, but it started in another parts of the body, which now spread to the liver. Next, we are going to see a figure from the WHO regarding the mortality causes of diseases among Vietnam populations. As you can see from the chart, the non-communicable diseases are estimated for 77% of all death, and about 20% of them are from cancers. And the figure will tell you in both male and female the different kinds of cancer back in 2018. As you can see from these charts, liver cancer actually is the leading cancer in male patient among Vietnam population, whereas for female is still the commonest cancer is breast cancer, 20%. So I borrowed this slide from this, I think the biggest hospital in the Ho Chi Minh City, Cho Rei Hospital, whereby they present on the liver cancer. As you can see, from 2010 to 2016, there is a consistent rise of new cases of HCC, the primary liver cancers. And expected, the male is contributed 80% of the liver cancer as compared to about 20% from female. And liver cancer is not only a cancer of older patients. As you can see, even at the age group of 20 to 30, there is about 2%, 30 to 40, about 6%, and 40 to 50 is about 20%. The rest are those aged more than 50. So this we have to be cautious. Liver cancer is not just an old man disease. Next, I would like to share with you for all liver cancer, all form, especially the primary liver cancer. This is a picture tells you the progressions, the stages of liver damage until the stage of cancer. As you can see from this picture, on the left-hand side is the healthy liver, and when you have steatosis, meaning the fatty cell accumulation in the liver, which followed by inflammations, then over the years, patient will have scarring. In medical term, we call fibrosis, meaning the liver getting harden, and subsequently it will enter a stage of cirrhosis, means the liver is very stiff, and over the subsequent years it may progress to liver cancer. These are the stages will happen to patients with chronic liver diseases such as viral hepatitis, alcohol, non-alcoholic fatty liver disease, and hematochromatosis, meaning the iron overload in the liver. So the main causes of liver cirrhosis, the hardening of liver and liver cancers are, again, chronic viral hepatitis B and C, smoking, alcohol abuse, and obesity. Besides that, there are other rarer causes include genetic diseases, steroid abuse, and dietary exposure to alpha toxin is a form of toxin in the food. Next, I'm going to tell further about this commonest risk factor, which are the viral hepatitis B and C. Usually, especially before the vaccination takes place, hepatitis B is commonly transmitted from mother to children, and also it through blood transfusion. Of course, now with the safer screening test before the blood transfusion among the blood donors, this route of transmission is getting lesser. But all over the world, now we are having another problem, which is the intravenous drug abuse, those drug addicts, which leading to a new rise, a wave of hepatitis C in particular. Of course, the other one is the high-risk behavior, such as sexual promiscuity, having multiple sexual partners. And next, the commonest cause for chronic liver disease, cirrhosis, and cancers is alcohol abuse. In the past, we used to say the safe level for chronic alcohol intake is 2 units or less for female, or 3 units or less for male in a day. 1 unit is almost equivalent to about 10 grams of alcohol, or in our layman term, 1 can of standard drink. But in the recent year, especially from the medical field, oncology, the advice is, as far as possible, try to best avoid alcohol. So going back to the Child Ray Hospital data, we can see about 41% new cases of liver cancers in the far advanced stage, meaning they are diagnosed at late staging. And about 90% of patients, they are screened for hepatitis B and hepatitis C. And not surprisingly, 62% of the liver cancer patients are having this hepatitis B infection, and 26% of the cancer patients had hepatitis C. And about 3% of them had both hepatitis B and C. So as you can see, 91% of the cancer in the liver are related to this both chronic viral hepatitis. Unfortunately, the most patients at the advanced stage, like I mentioned before, and it also reflects the same thing, not more than 91% are related to hepatitis virus infection as the cause of liver cancer. In Vietnam, most liver cancers are related to hepatitis viral infection, and most commonly is hepatitis B. But as in other part of the world, hepatitis C infection is increasing because of the drug abuse. Cancer is preventable and treatable. I think the third challenge that we are having beside the chronic hepatitis B, C, and the habit is obesity. So from this chart, from the ASEAN country, as you can see, most of the countries are now having an increasing trend of overweight and obesity for those aged 18 and above. But trust me, even the younger ones are having the weight issue. As you can see in this chart, Vietnam populations of overweight and obesity is rising from about 9.2% to 21% in 2020. Obesity is not only associated with liver cancer, it is associated with multiple cancer, as you can see from this picture. It can associated cancer in the brain, cancer in the esophagus, thyroid, in the breast, in other parts of the gastrointestinal tract like gallbladder, stomach, pancreas, colon, and also in female reproductive organs like the uterus and ovary. And they are also associated kidney cancer and blood cancer. Next, we are going to talk about signs and symptoms of liver cancer. It could be very non-specific. Patient may present with pain, vomiting, jaundice, they have low red cell anemia, itchiness of the skin, they may have weight loss, they may have non-specific fever, and they may feel a lump in the abdomen. What can we do to prevent liver cancer? I'm sure as the top leading cause of liver cancer, which is the hepatitis B and C, so both of these infection can be treated now with a very good treatment. And hepatitis B, we can do vaccination to prevent the infection, but there is no vaccination at the moment for hepatitis C. Of course, we should avoid obesity. As you understand just now, obesity, diabetes will increase the risk of cancer. They should stop alcohol, stop smoking, and avoid eating food that contain this aflatoxin, which is a poison for fungus which can grow on the food that have been stored in hot and humid places. The only thing that we can't really do about our genetic, such as the rare hematochromatosis, but yet if we can find and treat this disease early, probably we can delay the development of liver cancer. How do we screen for liver cancer? We are not recommended for population-based screening. We recommend routine screening for those at high risk. Those high risk include patients with liver cirrhosis and may consider in those with advanced liver fibrosis. For chronic hepatitis B, those with family history of liver cancer, or male more than 40 years old or female more than 50 years old should go for screening. The screening we do using ultrasound scan and blood cancer marker, which is the alpha fetoprotein, usually 6 monthly. We seldom use liver biopsy to make the diagnosis for liver cancer. Doctor will interpret the result as such. If both ultrasound is normal and the blood cancer marker is normal, then we will do it every 6 months. Sometimes we will find a small lesions on the liver ultrasound, less than 1 centimeter, then we can repeat the test in 3 to 6 months to monitor for the growth. If anything more than 1 centimeter or the higher value of blood cancer marker, then we will proceed with a more detailed diagnostic scanning, which using CT scan or MRI. Liver cancer staging depends on several things, such as the number, the size, the local or distant spread, and very important also the patient performance status and liver function using this score, the Child-Pugh score. This is a scoring to tell how well the liver is working based on the level of damage by cirrhosis. Basically, the score will result in 3 classes, which is A means the liver is still working well and the cirrhosis is less advanced. If Charles B, liver function is moderately well, and child C, the liver is not working well, and patient have a 1 cirrhosis. For early stage of liver cancer, basically means 1 to 3 lesion in the liver, less than 5 centimeter, usually involve one side of the liver. If intermediate stage, we have more than 3 lesions involving both sides of the liver and involving the blood vessels of the liver. For a 1 stage, means those cancer already has distant spread, or patient had poor liver function, Child's Pugh score C, or poor performance status. There is also another stage scoring system which commonly used by doctors to stage the patient, but ranging from very early to end stage. Again, very early means small lesion less than 2 centimeter with child Pugh A. Early is up to 3 cancer less than 3 centimeter, Child's Pugh A to B. Intermediate, many cancers in the liver, child Pugh A and B. In advance, the cancer has grown go into the main vessels or in the lymph nodes or other body organs, Child's Pugh A and B. For end stage, basically anyone with child Pugh C, regardless of the number of size of the tumor itself. Again, refer back to this data from Vietnam itself. Over the years, you can see more than 40% of the cancer patients were diagnosed at the advanced stage. It is very important because the treatments of liver cancer is decided by the stage. Most patients with liver cancer will have treatment with thermal ablation, a treatment using the heat to destroy the tumor, or transarterial chemoembolization, TACE, which deliver the chemotherapy directly into the cancer. Surgery is only used for about 5% of patients, especially those with very early stage, because not many patients were diagnosed at this early stage. Most patients are diagnosed at stage A and B, where they can still use ablation therapy, TACE, surgery, or liver transplant. For those who in stage C, advanced stage, usually we need to use targeted therapy or chemotherapy, or some of patients may go for palliative treatment. For those with end stage, stage D disease, usually we will only provide palliative treatment or into clinical trials. And some patients with liver failure, but just a small tumor, may be given a chance for liver transplant. These are the diagrams just to give you an idea what type of liver surgery can be done. It can involve the removal of the right side of the liver or the left side of the liver, but sometimes we will do the extended removal of the either part of the right or left side. Very rarely, if patient comes in early stage, we can just remove a small part of the liver. And this is the TACE. It means we deliver the chemo directly to the cancer in the liver using the blood vessel through the vessel in the leg, and the doctor will deliver the chemotherapy to the cancer, and subsequently they block the medication here so that it will stay inside the liver to kill the cancer cell. And by blocking the medications to stay in the liver, it will reduce the side effect of the treatment. Of course, liver transplant probably is the second best treatment for the liver cancer if you can get a donor, because basically you will get a new liver either from a living donor or cadaveric donor, means the donor already passed away. Again, to show you, if early cancer, small one, if we are in the setting where you have a very high resources, very good medical support, you can do many things, including transplant, surgery, and ablation. For those limited resources, probably we will do with ablation. For intermediate stage, like I mentioned before, most of the hospital will use the TACE. Some they will use the sorafenib, is a medications like a chemo medications. If they don't have this specialized radiologists to do the TACE. For terminal stage, no matter where you are, usually we only recommend best supportive care, because the survival is usually less than few months. So in conclusion, liver cancer is a very rare, common, but yet many diagnosed at later stages. Now we have effective vaccinations and antiviral treatment for hepatitis B and C. This together with healthy lifestyle hopefully will reduce the burden of liver cancer tremendously.
Facebook của Trần Đức Mạnh có hỏi rằng ung thư gan với viêm gan có giống nhau không bác sĩ? Tiêm vaccine viêm gan rồi thì có nguy cơ bị mắc ung thư gan không ạ?
Is the inflammation and cancer the same? So when we are vaccinated of the hepatitis B, we will have risk to get the cancer.
Okay, so hepatitis B vaccinations first, like all vaccination, it is to prevent the hepatitis B infection, and so far, not all patients with vaccination will be protected from hepatitis B infection. So if a patient did not achieve the level of protection for hepatitis B, so that patient still has risk to get liver cancer if he or she gets hepatitis B infection in the future.
Okay. Thì vaccine mà để khi mình tiêm viêm gan siêu B đó thì nó cũng giống như tất cả các loại vaccine khác thôi các bạn. Có nghĩa là nó không bảo đảm 100% là khi mình tiêm vô là mình sẽ không mắc bệnh viêm gan siêu B nữa. Cái lý do ở đây là gì? Có nghĩa là khi mình tiêm vô vậy, mình tiêm vô con người mình, nhưng mà có nghĩa là kháng thể của mình nó phải đạt tới một cái mức độ nào đó, nó phải đạt tới một cái ngưỡng nào đó, thì lúc đó mình có bị nhiễm cái con virus viêm gan siêu B vô á, thì cái kháng thể của mình nó mới chống lại được. Còn nếu mà trong trường hợp mình tiêm đi rồi đó, nhưng mà cái kháng thể mình chưa có đạt được cái ngưỡng để mà chống lại con virus đó, thì khi con virus nó vào thì mình vẫn có thể là bị nhiễm.
Có một cái câu hỏi này thì chắc là cũng nhờ anh Thanh dịch dùm và bác sĩ trả lời luôn liên quan tới việc điều trị về cái gọi là chế độ ăn uống và dinh dưỡng cho những người thực hiện hóa trị với lại xạ trị về ung thư gan.
So if someone have already received chemotherapy, so we generally advise them to have still a well-balanced diet, because after you receive the chemotherapy, your body need to repair. Okay, not because the cancer therapy not only kills the cancer cell, it will also involve some of your normal body cell. So you should have I would say a well-balanced diet, and in fact here we will advise patients to take those nutritional milk products to make sure they have a well-balanced. The chemotherapy may have side effect, poor appetite. They may not have their usual diet. So this milk supplement, the well-balanced milk supplement will be a good option.
Thì đối với những người mà mới xạ trị về hóa trị gì đó thì cơ thể cũng cần phải có một chế độ dinh dưỡng tốt, bởi vì mà những cái việc là cơ thể nó sửa chữa là những cái tế bào của mình thì nó cũng cần cái chất dinh dưỡng để nó phục vụ cho những tế bào khác. Thì một trong những cái mà cái phương pháp cái thực phẩm mà bác sĩ mà gợi ý cho mình đó là mình nên bổ sung, đó là những cái sữa dinh dưỡng, bởi vì cái sữa dinh dưỡng này cũng một trong những cái lựa chọn tốt để cho người sau khi được hóa trị.